Hey guys, welcome to episode 5 of Note to File podcast, a collection of interviews, best practices, and ramblings for clinical research sites. My name is Brad Hightower. You can check us out at notefilepodcast.com. Thank you for tuning in. Today is our first interview. It's with a good friend of mine. His name is Kartik Munshi. We work together at the Oklahoma Heart Hospital Research Foundation. He is currently the operations manager for the Cardiovascular Medicine Department at University of Kansas Medical Center. He's worked in clinical research for over 10 years. Super sharp guy. Let's check it out. All right, Kartik, thank you so much for coming on today. How are you holding up there in Kansas?
I'm doing great, Brad, and thank you for inviting me for this. I'm really excited.
Absolutely. And you mentioned before we started recording, sounds like you guys are starting to get back to work up there.
Yes, currently the policies are that we are, we are allowed to come back to the campus, but as long as we can get our work done from home, preference is that to stay at home. But if we have a patient visit to do, then yes, we are coming back.
Yeah, no, we're kind of doing the same thing down here. You know, as much as possible. You know, I don't want people to be in the clinic any more than they have to, but at some point, you know, patients are starting to come back in and people are getting a little more comfortable. Whether that's a good or a bad thing isn't real clear yet, but that's good to hear. And it sounds like there's a lot of studies coming up. So again, it's a good sign for the industry that, you know, studies are starting up or starting to continue. We had studies suspended that we're still waiting on to start up again.
Yeah, we stopped actually all the enrollments and then we restarted like a week ago or 10 days ago, I would say. And then as far as like new study wise, I would say like, yeah, it's a good news for the industry that, you know, new trials are coming up, sponsors and the companies are willing to do more studies. So it's like we have to see how patients are interested now to participate.
Yeah, no, that's been a problem for us. I know that we never really closed per se, but truthfully, I mean, we had patients who we couldn't get anybody in, even if we wanted to be up in the clinic. So it's going to take some time till everybody's kind of real comfortable with the new normal, if you will.
Yeah.
Well, very good. I know we've known each other a long time. We work together at the Oklahoma Heart Hospital Research Foundation. I'm always kind of interested to hear about people's story of how they got into research. So, if you will, tell us a little bit about, you know, your history and how you got started on clinical trials.
Sure. So I started as a student actually during my MPH at Tulane. And that time I worked on a study for endocrine department. It's called the ACCORD study. And I used to basically interview patients for a sub-study which was called Memory in Diabetes. In short form was MIND. So I used to interview and conduct different cognitive tests and kind of record the interviews and send it to the coordinating center. From there, my boss, Roberta, she got me hired for full-time with cardiology department at Tulane. So that's how I started as a research coordinator at Tulane and then kind of learned the tricks of clinical research. I was trained basically by Roberta and one of my coworkers, and on different processes of the clinical research, like IRB submission, study startup, and patient follow-ups, and all.
So you got a pretty broad training from the beginning, it sounds like.
Yes, because my boss, Roberta, she was also the IRB chair at that time. So, you know, that's why I have pretty solid regulatory.
Yeah, so that's a nice nice little bonus to have somebody who's on the IRB help train you.
Yeah.
Yeah, I think that's always kind of interesting to me how different departments are broken up as to, you know, how specialized people are within their departments.
Yes,
so
plus,
it's always interesting.
yeah. Plus, we were very small department there. Like it was just say two coordinators, and we had our boss over us. So pretty much both of us were responsible for all the studies and for doing all the work from like startup to the closeout. So
Sure.
that's how.
And I always think that's the best system to learn anyway, is that you have everybody kind of do everything.
Yeah.
It can be a little bit messy in the beginning, but you probably ended up with a lot better handle on how the whole process works since you were sort of trained from the beginning to go from beginning to end.
Yes, and initially I think I used to get a little frustrated with small things because I always wanted everything to be perfect, but then I had to kind of learn that sometimes it's okay to make mistakes, and you also have to learn how to fix it in a right way. So I think
Yeah,
that's
that's
how
true.
I.
And I think that's it's an important point in what we do where, all your work is checked by a monitor or a
Yeah,
CRA, and you feel like, you kind of spend your time getting beat up by, someone from the sponsor side.
yeah,
So just kind of keeping in mind that, you really just want to improve as you go. I mean, when you get a new protocol, it's like they're all new.
yes,
Every time you start a new protocol, there's stuff that you can't know until you just get in there and start doing it.
yeah, I
So I think that's
agree.
great advice. It's great advice for anyone in any point in their career in clinical research is, just focusing on continuing to improve and not being bothered by, the small mistakes that get made because it's just inevitable in what we do.
Yeah, and plus it's part of learning. Like I believe that I have learned a lot by making such mistakes, and I still keep learning new things. Like say I'm learning a lot now in my current role also of different things which I never say even thought about that this something can be done in another way also, and I'm still learning.
Yeah. So you've climbed up and now you're what is your title right now?
I'm the research operations manager with the Cardiovascular Medicine Department here at University of Kansas.
So that's awesome. So you've got a whole different role and a whole different kind of perspective than coming from more as a less of a coordinator and more of an operations manager now.
Yes, yes, it took me some time though.
Yeah, it's a whole different mess when you're dealing more with managing staff and dealing with people that aren't
For
your
sure.
research subjects.
Yeah, for sure, for sure. I mean,
That's awesome. So you're in the cardiology department.
yes.
Nice. And you came over. Said we worked together at the heart hospital, and you worked in quality a little bit there as well.
Yes, I did. I did like internal audits, QA audits, and also kind of helped with some of the SOP writing. Like recently before I left, I wrote a couple of SOPs actually related to the electronic signature and the e-regulatory system implemented at Heart Hospital. So I worked on that. Also worked on the corrective and preventative action plans. I wrote couple of those during my time at Oklahoma Heart Hospital.
Sure. Yeah, and that's again it kind of rounds out your experience all across the board there. So, are you
Yeah.
guys using electronic systems at the University of Kansas?
So we use a couple of different systems actually. In the way it's kind of unique system here, I would say. Like we have uh, RI, which is the Research Institute, which you can call a one-stop shop for everything. So they kind of support all the departments with research, and they support you with, say, the legal contracting and budgeting, and then the study build up, and they also kind of manage the study finances and manage the study for you. So for with them we use a system called Chris Velos, which is basically a CTMS. So that is one of the systems we use. Then for IRB, we use e-compliance. Again, that's an electronic IRB system they use. It's pretty similar to IRB.net.
Sure. So is the CTMS like a proprietary thing for the university, or is that a commercially available
I
CTMS?
bel
I don't think I've heard of that one.
I believe it's available, but it's kind of more customized to their needs and requirements. It's mostly managed by the department here. But I'm pretty sure I've heard that it's kind of available. But I never heard before I joined here. Like I only knew about the other ones we have used. So
Sure. No, it's interesting. So you guys have sort of a centralized. Sounds like the budget and contracting is centralized through a department there at the university. Then, yeah.
yes, it's like, they kind of negotiate for you. So they are, say, the middlemen, you can say, for the departments who do not want or who do not have, say, resources. Not every department is, say, as big as cardiology here, for example, or cancer center. So some other departments, they may have just one or two coordinators running the show for them. So it makes it easier on their part when somebody else can negotiate the budget contract. And with the bigger system, the legal issues are more prevalent. So, they just want to make sure that we are covered.
Yeah, no, that makes sense. I have to admit that I don't miss having to deal with the bureaucracy of a large institution. So I'm glad that it seems to work well for you guys there. It's always been a bit of a mess whenever I've seen it. So it's good to hear that you guys have it's a good resource for you.
Yeah, it's like, just like with everything, there are pros and cons of everything. So yes, it is a good resource, but at the same time, sometimes it kind of also slows down your startup time or things, which you can do in more faster way. So sometimes we do experience those things also.
Sure. Yeah. And I mean, that's to be expected, I think, with any large institution, but
Yes.
nonetheless, it's good that it's a resource that's there for the smaller departments, or maybe the departments that aren't as experienced in those different facets of the clinical research process.
Yes.
Well, very good. Well, what do you think, what's something you've picked up in your career that you consider sort of a best practice, or something you would sort of share with the other clinical research community out there?
One thing I learned very early when I started was that research in clinical research, it is very important to have a good documentation practice. So that is something I always follow, like, document every encounter, everything, whatever the phone conversation you have with the patient, and save every emails and all. And that is one of the things I have picked up, and I still follow that. Like if I'm consenting a patient, or even if I'm making a phone call to a patient, I usually jot down that our conversation, date and time of the call, and then whatever was discussed.
Yeah, no, that's great advice. I mean, I can't tell you how many people I talk to on a day-to-day basis. So trying to remember a conversation, or remember when a patient called, or when you ask them a question, is pretty much impossible. So do you prefer just to have a blank progress note page like in the front of your binders?
Yes. So what I did as a coordinator, that I created a progress note template, and it will have a column for, say, date, and then it will have bigger column to document the notes. And I would pretty much have that along with the study name and the patient, a place for patient ID, so that you can always put it together in a patient binder. And if things get here or there, or if you're late in filing, then you can easily find and file it with the proper patient chart. So
Yeah, no, that's
that's what
perfect.
I do.
Just create a template, and you're ready for any study, ready
Yeah.
to take a note at any time. Yeah, that's good advice. I'm terrible at that, so I applaud you if you're able to keep up with that. That's something that any coordinator can immediately start implementing. If they don't do that, I imagine that's probably a pretty fairly common practice. But again, I know that I struggle at making sure that I document every encounter. So that's a good advice. What do you consider to be some tools or resources you use that help you do your job better?
Um, I mean, again, given current role, I think one of the best thing is basically, I would say, Outlook calendar is what keeps me organized, and it gets me to my meetings on time. So that is one of the like the best thing I'm using currently. But apart from that, as a coordinator, I would say that keeping having regular meetings with the PIs, and as I said, documentation. And then one thing I always did as a coordinator before, I always involved the physician or the PI before talking to the patient or presenting the study to the patient. And that kind of gave the patient confidence that they are signing for something which their doctor also believes that it will be helpful. And that also helps enroll with the enrollment, and key it helps keep up with recruitment goals actually. So
Yeah, no, that's for sure. Again, another piece of great advice, as much as you can. And it can be more difficult depending on what your setup is. But if you can have the doctor present the study, even if it's not, ridiculously detailed, because you're going to go through that in the ICF process anyway. But at least if they can help explain what's involved in the study, kind of on the front end, truthfully, patients listen to their doctors for the most part. So to hear that coming from their doctor carries a lot more weight coming from, a random study coordinator they've never seen before.
yes.
So again, that's a great piece of advice. And again, that can be tricky depending on just what your setup is, or if you're a standalone research site, that might be it might not carry the same weight as being their personal doctor if they're seeing a, specific study doctor.
Yes,
But yeah, as much as you can, that's always a smart idea.
Yeah.
Well, very good. I want to thank you a lot for coming on, and I would love to have you back if we want to continue to go down some rabbit holes. Again, I'm hoping this sort of takes off to the point to where we can all, share our best practices and just sort of tips with each other. If anything else, where can people reach out to you if they want to talk to Kartik?
They can reach out to me on LinkedIn. I'm on LinkedIn and I'm very active there. I may not be posting as much as say you do, Brad, but I do every now and then. And I can also be reached out on my personal email, which is my first name, Kartik.Munshi at gmail.com. So, and again, if somebody needs to talk to me, I'm more than happy to share my phone number also.
Very good. And I'll put your contact information in our show notes. It's available at notetofilepodcast.com. And until next time, thank you so much, Kartik.
You're welcome. Thank you, Brad. Thank you very much. It was nice talking to you.
All right, guys. Thank you so much for listening. The whole reason I started this podcast is so that clinical research sites have a forum to share information, to share best practices, to share tools and resources they use. So please reach out with any questions or comments you might have. You can reach me at brad@notetofilepodcast.com. Thanks so much for listening. We'll see you next time.